Brugada syndrome. Street elevation, J-point elevation, T-wave changes. AD inheritance, M.F. Asians. NA plus channelopathy, CX cardiac death, due to polymorphic, VTVF. ECGW class I aortic antiarrhythmics, TXICD implantation. Type 1, Codestead. Type 2, Saddleback-Stead. Type 3, Saddleback-Stead. Pericarditis. Diffuse concave, street elevation, PR depression. Echo, autoimmune, markers. NSAID, observation, unless CX, for example, effusion, tamponade. Pericardial, effusion. Diffuse low voltage, R-wave in limb, leads, 5 small squares, massive electrical alternans. DDX emphysema, tension PTX, HF, if just limb leads, but normal, precordial, DDX, edema, echo, CXR. Pericardiocentesis. Cardiac, tamponade, electrical alternans, PE signs. Pulsus paradoxus, Beck's triad, 1, high JBP, 2, low BP, 3, muffled HS. STEMIs, new street elevation at the J-point in 2 anatomically contiguous leads using the following diagnostic thresholds. 0.1 mV, 1 mm, in all leads other than V2 and V3, where the following diagnostic thresholds apply. 0.2 mV, 2 mm, in men 40 years, 0.25 mV, 2.5 mm, in men, 40 years, or 0.15 mV, 1.5 mm, in women. Anterior, STEMI, street elevation in anterior leads, V1-6, I, ABL, reciprocal street depression in inferior leads, rule out early depolarization, SBIF, young. 9. Cardiac enzymes, TX, aspirin, statin, primary PCI or thromboly. TX, aspirin, statin, primary PCI or thrombolysis. Inferior, STEMI, street elevation over 2, 3, AVF, reciprocal street depression in AVL, look for concomitant posterior MI and RV infarct, complications, papillary muscle rupture, inferior infarct, ventricular septal defect, anterior infarct, AV block. Inferior, STEMI, street elevation over 2, 3, AVF, reciprocal street depression in AVL, look for concomitant posterior MI and RV infarct, complications, papillary muscle rupture, inferior infarct, ventricular septal defect, anterior infarct, AV block. Pulmonary embolism features 1. Sinus tachycardia 44%, 2. RBBB 18%, 3. Right ventricular strain pattern. Right ventricular strain, street depression T-wave inversion in 1. Right precordial leads V1-3, 2. Inferior leads 2, 3, AVF. 4. S1, Q3, T3, 20%, I, deep S waving lead I, 2, Q waving lead 3, 3, T wave inversion in lead 3. Dextrocardia features 1. Right axis deviation, 2. Positive QRS and AVR. 3. Lead I. Inversion of all complexes. Global negativity inverted P. Wave. Negative QRS. Inverted T. Wave. 4. Absent R wave progression in. Chest leads. Dominant S waves. Throughout. DDX. Reversal of left and right arm electrode. Similar picture to dextrocardia but with normal precordial leads. General guidelines. Describe the abnormalities: trachea hilum, lung pleura, CPA diaphragm, heart mediastinum, soft tissue bones. Describe lesion, tissue involved, lung, heart, aorta, bone, etc. Size, large, small, varied. Side, right, left, unilateral, bilateral. Number, single, multiple. Distribution, focal, widespread. Position, anterior, posterior, lung zone etc. Shape, round, crescentic, etc. Edge, smooth, irregular, spiculated. Pattern, nodular, reticular, net-like. Density, air, fat, soft tissue, calcium. If CXR appears normal, hidden areas, apex, costophrenic angle, diaphragm region, retrocardiac region, small pneumothorax, S-apical region, micronodular miliary shadows, asymmetrical hypertranslucency, for example mastectomy. Next steps: most common etiology, investigation, 2DDX, pharmacological treatment. PTX, pleural effusion, TB opacities over apex, lung CA plus lung collapse, obstructing, coin.